Hello, welcome back to Hope TV. I'm Kawanda Green, and this is Surviving and Thriving in a Pandemic. Thank you so much for joining us. Many people use drugs as a way to cope with day-to-day pressures and isolation. For some, it's recreational use, and it turns into substance abuse. We have marijuana, cocaine, meth, heroin, and then we have the legal prescription drug opioids, Percocet, morphine, fentanyl. Today we're talking about substance abuse. During the pandemic and some of the stigmas that is attached to it. Substance abusers are often labeled as crackheads, dopeheads, and junkies, just to name a few. These labels are offensive and reflect a moral judgment. Many people do not recognize substance abuse as a disease. They consider it to be a moral issue where people make a decision to use drugs. To enlighten us more on this topic, I'm excited to welcome Dr. Kenesha Hall, a board-certified anesthesiologist, counselor, public speaker, and published author, who is currently practicing telemedicine and addiction medicine in 4 different states. Let's welcome Dr. Hall to the show. Hi, Dr.
Hello.
Hi. How are you today?
I am doing well.
That is awesome. The weather is changing. It's getting a little chilly, but we know that it'll go back and forth probably till December. Can you tell us a little about yourself and what you represent?
So I am a proud Howard University graduate. Go HU. I'll start there. And I just have a passion for bringing people with problems to a solution, which is why I got into healthcare, and particularly with addiction medicine when it comes to people of color. I wanted to be a representation that there's someone out there that looks like them, that is fighting for them as they fight every day with a disease. And that disease is addiction. It's not a conviction, but addiction is an actual medical diagnosis. There are people who are predisposed to addiction, and they will see it as they have family members who have suffered with alcoholism and other addictive personality traits. So I just want to bring awareness to it as a medical diagnosis and also present solutions for these people who are suffering.
You wrote an article titled Keeping Addicts in Mind During the COVID-19 Pandemic. Can you talk to us a little about that?
So in my practice, because I am an anesthesiologist, I was called to the front lines of this pandemic to actually initiate life support, intubate. That means place people on breathing machines, the sickest of the sickest patients during a pandemic. And in the throes in the beginning of this pandemic, I was completely engulfed in my hospital practice. And I've been practicing addiction medicine for the past 6 years or so. And I know that my patients were being neglected because I was on the front lines. Luckily, I work with an amazing group of physicians who could pick up the slack. And that's when telemedicine came into place. We have virtual clinics where people can check in, just like we're doing this interview virtually and online. Our patients can check in, go to group, get therapy, see a physician, see their psychiatrist, see their wellness coaches. But there was still, at first, a drop-off of attendance because practitioners were tied up fighting a virus. And once we noticed that we needed to be back on the front lines of addiction, we saw a humongous uptick in enrollment in our clinics and programs because people need help. There are sometimes just like you said in your introduction, they have nowhere else to go. The economy is horrible. People have lost their jobs. People are dealing with the panic anxiety of a pandemic and being claustrophobic, closed in their houses. And if you already have a problem with addiction, there are several things going on right now that will push you over the edge. So when I noticed that uptick in enrollment, I wanted to just kind of be an eye-opener to the public, but also my colleagues who practice both addiction medicine and other specialties. You are needed on these front lines of the addiction warfare that we're fighting, just like you're needed on the front lines of a pandemic.
Mm-hmm. Mm-hmm. You said initially you were giving the medicine to like the sickest of the sick, like sick. How did that affect you? Like doing that, every day?
So I recently actually did a previous interview about the stress that put not only just on me, but on my family. Um, there was a period of time for almost 2 months I did not hug or kiss my mother because
Wow.
I was working and I never wanted to expose her. I was ultra careful. And anyone who follows me on social media, I actually went through and kind of cataloged what I would go through as I would decontaminate myself, leaving the hospital and getting back home in my garage before I would even cross my threshold of having to strip down and decontaminate before I would enter into my home. But even being that careful, and I didn't even notice it until weeks had passed because my mom actually stays with me. I'm in a multi-generational household. I have a small child and my mom helps me with her. It was weeks into the process and completely abnormal because I've lost a parent. I lost my dad in 2008. So I actually realized I had not hugged, embraced, or kissed my mother. And I broke down in tears. And when I brought it to her attention, she confessed that she had noticed it as well, but understood that I was being cautious for her health.
Mm-hmm.
And that required a little bit of group and family therapy in itself, but it was an extremely stressful situation. And you kind of carry the weight of the world because I know that I'm needed on these front lines. But when my other colleagues are telling me, hey, we have our addiction medicine patients who are really struggling right now, and they need you too. I have to split my time in between the two.
So you said that when you got home, you had to take all of that off in the garage. How do you take all of that out of your mind? How do you separate? How do you leave that out there?
Faith. Because I recognize there is someone bigger than me. I have to recognize that there is someone bigger than me. And though I don't understand all of this right now, I am just like the general public. I don't understand all that is going on in the world right now, but I do have faith that there is a larger power that is in control. He will not put more on me than I can bear. And he has blessed me with a gift and a tool to help people, and I'll use it until my last breath.
Mm-hmm. You said that there was increased enrollment for the substance abuse. How were they enrolling? Like people were just volunteering. Like, do you think their family was getting them to do it, or they just recognized they had a problem and they were just enrolling?
It's actually a mixture of both. So the company that I work with is called Bright Heart Health. They are practicing in just about all 50 states. My colleagues are very, very well trained and well credentialed physicians, psychiatrists, wellness coaches, therapists, licensed clinical social workers all over this country. And there are patients that would find us online just by Googling addiction recovery. And there are family members who were at their wits' end and didn't know where else to turn, but they don't want to abandon the person that they love, but they don't have the tools to help them. So they would reach out to us to see if they could get us in on Zoom and talk to someone, and literally just to show them, hey, we care, but we don't know what to do.
I read last night that there had been an increase not only in substance use and abuse, but also in accidental drug overdose deaths during this pandemic. What are some signs that a loved one can, notice about someone who's using or abusing?
So whenever people tend to withdraw, it's time to get worried.
Okay.
Usually if their patterns of behavior are changing, They're leaving the house earlier. They're coming back in later. They're staying away from other people, avoiding other people. When people start to withdraw, that's time. It's time to check in. And I always tell people, when you're checking in, always lead with love. It's not judgment. Want to help, but always start from a place of love. Like, hey, I'm noticing some things. I love you. I don't have all the answers. I don't know how to fix it. I don't know if you're hurting. I don't know if you're depressed. I don't know how you feel. Please talk to me because I love you and I care. I'm not here to judge. I'm not saying I have all the answers, but together we'll go find some answers. But talk to me. How are you doing? How are you coping? Especially if a lot of people know that they have loved ones, family members, even dear friends who are suffering with some form of addiction from alcoholism. Don't lead with that. Lead with love. I care. I want the best for you. I never want to lose you. Like you mentioned, there have been a lot of accidental overdoses and accidental fatalities. It's not that people are intentionally causing harm or trying to take their own lives. They're trying to numb the pain, and the pain is off the charts. So they self-medicate and self-medicate until they get to this dangerous, dangerous place. So whenever you're noticing a loved one starting to withdraw or any changes in behavior, lead with love. Like, hey, something's not right here. I'm noticing something here and I care. How can we fix it?
I have another question, but I want to ask you this. I noticed that you are very passionate about this. When did you become so passionate about this field?
I won't say everyone, but the majority of people in this country have been touched by addiction. I have a dear family member that I love, adore, respect, and look up to who has battled addiction. And
Okay.
I'm not here to judge. I still love, I still admire, still respect this person to this day because I've seen the recovery. I know it's possible. And not just recovery, just like we're talking, not just a successful testimony, but thriving, 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 a great parent, a great professional, a community leader. And to think just, I'd say, 2 decades ago, you would have found this person in a crack house.
Oh.
So for me to know what is possible, I have to be a part of that process of making that someone's testimony. I have to be a part of that because I know it's possible. I've seen it. I have so many patients who are decades into sobriety, no relapses. So, of course, I definitely want to stay engaged with them during this time. You just mentioned the weather is changing. There's a condition called seasonal affective disorder, SAD. It's around the time where we have less sunlight, the weather gets colder, and people just feel down and don't know why. Compound that with pandemic panic, election anxiety, and the PTSD of living while Black. You have a catastrophe for mental health just right there. So it makes me even more so want to be on the front lines of letting people know there's help out here. There are actual clinical professionals who are here to help. We recognize this is a problem and we want to give real life solutions.
Dr. Hall, I got to confess. When I talked to you previously, and you compared drug abuse to cancer, I didn't get it. It didn't make sense to me. After doing research, I understand it so much more. Would you mind painting a picture I understand it more, but if you can paint a picture for me and the viewers so that we can get a better understanding.
I'll give you a similar analogy, but I'll give you a little backstory. Imagine someone who grew up in the 60s and 70s, where there were actual physicians who did smoking commercials. So they smoked. And when they are diagnosed later in life with lung cancer, we don't wag our finger at them and like, oh, you got cancer because you smoke. Or even now, you know someone or you may know someone that smokes. And knowing that smoking causes cancer, you never ever judge the person when they're given that horrible diagnosis. You support them. We have awareness. We have telethons. We raise money. We do the research. We do all that is possible in a community mindset to uplift this person and get them from diagnosis to treatment to testimony. You have addiction. A great deal of people with addiction have a family history of someone in their family with alcoholism, drug use, or obsessive compulsive disorder. They have to have things a certain way. They're very, very meticulous. Now, the difference between myself and that person, I may have a glass of wine and the dopamine receptors in my brain are happy. However, their dopamine receptors are hyperactive and they need more and more and more and more. And when I am talking to them and I reach that diagnosis of addiction, there is no telethon. There is no ribbon of support. There is no community effort to get that patient from diagnosis to treatment to successful testimony. There's only finger pointing and judgment. You're an addict. You're a crackhead. You are delinquent and you are criminal. You are deviant. And that is all false. You are a human being with a medical disorder that needs help. And that's why I'm glad that people are talking in terms of addiction medicine. There are medicines to help. There are physicians to help. There are clinicians, therapists, wellness coaches that are all involved to help with this actual medical diagnosis.
I was talking to a friend of mine when I was doing this research this weekend. And when we were talking about it, it was like a light bulb went off in his head. He was like, you know what? I need to call my sister. I was like, why? He said, because, she's an abuser and, she's hard on herself. And then, he's hard on her. You need to get yourself together. You need to get yourself together. He was like, but I want to go talk to her. I want to go to her house and say to her, I'm here for you. How can I help you? I love you. He totally turned around how he looked at it. And he totally see how what you're saying, that it's a disease.
It is.
So do you think that the abusers realize or actually understand that it's not a choice, but it's a disease? I know that the
That's
people don't,
part
but
of the recovery. Getting them to that realization is part of the recovery because they're beating themselves up because something is wrong with them. When you talk about people, will talk about this often when they're talking about domestic violence. Like, why does the woman blame herself for someone attacking her? When we talk about rape, they are hardest. The addiction patients that I deal with are hardest on themselves than you could ever be because they believe what society says about them. That's why they hide. That's why they don't seek treatment because they believe that they are deviant as well. But when you get them to that point of realization, you have a medical problem and we need to treat that. And it's going to be hard. It's going to be one of the hardest things you may ever do in your life, but it will be one of the most rewarding. And the thing is, you don't have to do it by yourself. And nobody wants to do anything by themselves. So when they realize they are in a fight, but they're not in a fight alone, they can quit fighting themselves.
Opioids are used to treat pain. How does it transition to an addiction? How do they go from use to abuse?
Well, that's a very good question. And it's similar to what I was saying earlier. There are people with a predisposition towards addiction. And pain in itself is a disease process and a disorder, but it's most likely associated with something else. People will get into a car accident. They will break bones and bruise and damage their muscles. And just because I give you that medicine one time, it takes time for bones to heal and muscles to mend. So your body is using the medication to treat the pain associated with the injury, but there's a psychological component to that too. Because what if you're in an accident and you were on your way to work, you were minding your own business, and somebody comes out of nowhere and knocks your world off its axis? You weren't expecting that. So you have a physical pain, but there's an emotional pain too that is often unaddressed, because in that moment, everyone's focusing on that physical pain. But you notice as you're taking this medication, it's treating the physical pain, but it's also creating a dependence. Your body needs it because you're damaged. And there are other psychological pains you aren't dealing with in that moment. And that's not always the case for everyone. But like I said, there are people with these predisposing elements that make them more likely to develop addiction than others.
Are there people who are susceptible to addiction? Are addictive personalities hereditary?
The word that we're not using is hereditary, but we do say familial traits. When I talk to my patients that are addicts, there's somebody in the family that might not ever have been diagnosed as an addict, but they drank every day of the week. They could never quit smoking no matter how much they tried. They had family members that smoked until they died of cancer. And you see these traits, these familiar traits where you're like, there's a history of addiction here.
What about rehab? How do we get them to rehab?
So rehabilitation is just the beginning. And getting someone to admit that they need rehabilitation means that you have to get them to admit that there is a problem. Mm-hmm. And again, I say whenever you start this conversation off, especially with someone that you love, lead with love. You can't make anyone, you can't make a grown person do anything unless it's by actual legal action and we got the courts involved. So lead with love, and similar to the resources that you probably used in your research, have them Google some statistics, Google their symptoms. Do they have a craving for something, and ultimately they have made a substance a part of their daily lives that they feel that they cannot live without? And the wonderful thing about telemedicine is it does help us cross over that biggest hurdle when we're trying to initiate treatment with our patients, because you don't have to physically go into the doctor's office. People won't see you coming in and out of the clinic that's for addicts. It's just as simple as a virtual teleconference where you can participate with your support, the person who cares about you, just to talk to a professional like me that wants you to understand this is a medical diagnosis. And we're here to help. You don't have to go through any of this alone. So we have outpatient programs. There are inpatient, more intensive programs. There are faith-based programs where we have actual counselors who are linked to churches and other organizations of faith. Celebrate Recovery is a wonderful national organization that has made a celebration of people who make that decision every day to fight for their sobriety. And being sober is one of the hardest things you may do, but one of the most rewarding things someone can do in their life.
So what's the next step in helping the patient, families, friends, coworkers, and the world understand that this is a disease and not a choice?
The next step is awareness and education, but having conversations just like we're having right now.
Okay.
You have a newfound enlightenment. You already have a friend that you said has a newfound enlightenment. And I always challenge people, you leave the conversation you're having with me, have it with your good girlfriends. There's nothing wrong with having the conversation. And from those conversations, even when there's a difference of opinion, you have created awareness in a space where it was not.
That's true. And after they take the step to admit that they have a problem and they need help, what should they do next?
Don't wait. Literally get on your phone, the internet, find the closest group recovery. Again, I work for a wonderful 24-hour-a-day virtual clinic at Bright Heart Health. There's Celebrate Recovery. All you have to do is Google addiction recovery, and there are resources at your fingertips. And I would start right there. Find a meeting, find a group, find a provider that can see you right away. Don't give them time to doubt themselves that this is something that they don't want. Oh, the longer you give them, they're like, oh, this is too hard. This is too hard. No. In that moment, get connected. Get connected to a professional, an addiction medicine specialist, a counselor, a therapist. Get connected right there.
Dr. Hall, what is the message you want to get across to us today?
No matter how crazy this world might get, just always lead with love. And know that you have been given everything inside of you to combat whatever comes your way. It might not seem like it at the moment. And sometimes you got to have a good group of people around you that pull out what you need when you need it. But I promise you, he will not put more on you than you can bear. Absolutely.
Thank you so much, Dr. Hall. This has been so informative, and I am so grateful for this opportunity to speak with you. I have learned so much. I'm telling you, like, I've never understood it. I'm being honest with you. I've never understood it. I guess because, first of all, I haven't done it, but, I didn't understand. And this has been so educational for me, and I hope that the viewers have been educated as well, because you've given us so much great information.
It has truly been my pleasure. I am grateful for this platform that is educating the public and also give them the resources that they need to not only survive, but thrive. And I think that's a wonderful, wonderful mission.
Awesome. Thank you, Dr. Hall, and thank you for joining us. You don't get arrested for having hypertension, heart disease, or diabetes. However, you will get serious jail time for substance abuse disease. Substance abuse disease is no more a choice than depression or bipolar. Once we realize it is a disease, we'll treat it like one. We must get rid of the stigma and replace it with kindness, empathy, compassion, and love. Because of that stigma, people are too ashamed to get help. Let's remove that stigma and be supportive. Stop being embarrassed and get some help. We love you. We are here for you. Share this episode, hit the like button, drop us a comment. Remember, if you have health, you have hope. And if you have hope, you have everything. See you next time.